In late February, the Food and Drug Administration issued an emergency use authorization for the third COVID-19 vaccine in the United States. According to a press release from Johnson & Johnson, clinical trials found their vaccine to be 85% effective in preventing severe disease from coronavirus among people who are vaccinated. The thing that makes the Johnson & Johnson version, also called the Janssen vaccine, so different is that it is a one-shot inoculation, whereas both Pfizer and Moderna's vaccines require 2 doses.
The J&J is a single dose that will be massively helpful.
That's a good thing for consumers because it limits the amount of time you might have to experience side effects, which can be unpleasant, but generally aren't harmful, according to the Centers for Disease Control. The Janssen vaccine also solves the shipping and storage puzzle. Both Pfizer and Moderna's vaccines require extremely cold temperatures throughout the supply chain, a requirement that has been difficult for some states and municipalities to meet. Johnson & Johnson's shot does not require this cold storage, so it is easier to transport and store. Side effects for the Janssen vaccine are similar to those that people have been experiencing with the other versions. After the shot, a person might have some pain, redness, or swelling at the injection site, or feel fatigue, headache, muscle aches, chills, fever, or nausea. The side effects generally begin within the first 2 days after getting the vaccine, and only last a day or 2. Rarely, people have reported side effects lasting up to 7 days. The side effects are an indicator that your body is responding to the vaccines and building immunity to COVID-19. Johnson & Johnson used research they developed in creating their Ebola vaccine to create what's called a viral vector vaccine. The inoculation introduces an adenovirus that has been genetically modified to carry the code for the SARS-2 spike protein. The body recognizes this modification once it enters a cell and uses it to create more spike proteins, which trigger your body to produce antibodies that fight coronavirus. In clinical trials, about half of the people who received the Johnson & Johnson vaccine experienced localized pain, redness, or swelling at the site of the shot, according to Healthline. Most people saw side effects within the first 2 days after the injection and experienced them for 2 to 3 days. Only 3% of people experienced side effects for more than 7 days. 55% of people experienced flu-like side effects, which also began on average 2 days after the shot. Fatigue, muscle aches, and headache lasted an average of 2 days, with nausea and fever running their course in a single day for most people. Most side effects were reported by people between the ages of 18 and 59. The incidence of side effects decreased after age 60. Overall, fewer people are experiencing side effects after Johnson & Johnson's vaccine than with either Pfizer or Moderna. If the side effects are uncomfortable, there are a few things you can do. It is important that you do not take a pain reliever before your vaccination, as that may cause your body to suppress its immune response, according to WebMD. After the vaccination, it's fine to take a pain reliever like Tylenol to deal with the aches and pains. If you develop a fever, however, try to handle that with therapeutic care, like drinking plenty of fluids and dressing lightly. Dr. Paul Offit, director of the Vaccine Education Center and Children's Hospital of Philadelphia, told WebMD it's best to let fevers run their course, advising, "My general belief on this is it's never a good idea to blunt fever, because fever is an adaptive part of your immune response. Let your immune system do its job. When you go to get the vaccine, it's likely you may be asked to fill out paperwork that will contain a question asking if you've ever had an allergic reaction to a vaccination." Johnson & Johnson includes the warning in their press release about the Janssen vaccine that there is a remote chance that it could cause an allergic reaction in some people. This type of reaction is most likely to occur within a few minutes to an hour after getting the vaccine, so most vaccination sites ask you to wait for at least 15 minutes after your shot for observation. If you've ever had an adverse reaction to a vaccination, they'll likely ask you to wait for 30 minutes for observation, according to the University of Maryland Medical System. Indications of an allergic reaction would include symptoms like trouble breathing, swelling of the face or throat, increased heart rate, an all-over body rash, weakness, and dizziness. If you have had a reaction to a vaccination in the past, the CDC advises that you speak to your doctor before getting the COVID-19 vaccine to discuss the risks versus the benefits. If you get the Johnson & Johnson vaccine and experience any side effects which have you concerned, the CDC recommends calling your doctor. Things to watch for would be a redness or tenderness at the shot site that gets worse after 24 hours, or any symptoms that don't clear up after several days. If you do experience side effects that are concerning, the CDC and Johnson & Johnson request that you report them to the FDA/CDC Vaccine Adverse Event Reporting System by calling 1-800-822-7967. Check out one of our newest videos right here. Plus, even more Health Digest videos about the latest health topics are coming soon. Subscribe to our YouTube channel and hit the bell so you don't miss a single one.